issue of mental health and mental illness in particular, it doesn't sidestep anybody. It doesn't matter where they come from, what their background, what they have or do not have necessarily. I think historically maybe we would have thought about it differently than we, I think, need to today. When you look at the federal level, what we learned is that the regulations are really prohibitive oftentimes, and yet we have to work within them. At the state level, the way mental health services has been structured, oftentimes can feel prohibitive. And that doesn't mean it's bad, it just means to me there are impediments oftentimes that reveal themselves that really affect folks, the ability for people, again, right here in our communities to get the best care and the best attention and improvement in their circumstance. I think that's really what I've seen are some of the concerns. I think we can affect those, however. At the federal level, we are talking with our congressional representatives. We're talking with the General Assembly and local delegates here in the Guilford County region and getting their attention about us here in Guilford County wanting to be, we want to hold the banner high here, and we want to say, look to us, help us, support us, but look to us here in Guilford County as one of the best service providers on the behavioral health front, not only in the state of North Carolina, but really across the nation. It really starts at the point of access. It really is about bringing down those barriers that allow people to know where to go.
Sometimes you are reluctant, or you are afraid to seek help, but you do need to make that step towards finding help. And going to the hospital is not necessarily the first choice, because oftentimes we don't have that far of a vision to see down the line just where resources are available, what resources are available, where they're available, how they're available. We don't have those answers. It's almost foreign to us. A hospital and going there for a mental problem and getting assistance is foreign.
Mental health issues are real. They transcend socioeconomics. No matter what your background, lots and lots of people are facing these issues, and they cannot any longer be ignored. I would argue, as in my understanding, at least over the last couple of years in particular, that we're, if not at it, we're approaching a crisis when it comes to mental health condition across the nation, and we're seeing things, at least in my lifetime, that are more prevalent than ever before. We've got to step up and be willing to, change how we think about approaching and asking for care, when it comes to our mental health in particular.
For me, it was sort of luck, simply because I didn't have the knowledge or know-how to find certain places and to locate the resources. So for me, it was kind of luck, but hopefully others in similar circumstances do have ways of finding resources that they need when they need them.
I think we've got to really think in a collaborative manner and get key stakeholders around the table who really have a passion, not just within the arena of mental health services, but around the arena, who can help influence change on behalf of our citizens. That's a real key. If you just stay inside this arena and don't branch out to get more support and help to shore up those efforts. I think you could find some limitation and maybe some discouragement, but just keep in mind there are other people like me, I have no doubt in my mind, out here, not only in our community, but every community across the state and across the nation, who may not be fully aware of their opportunity for change, may not know necessarily how to implement change or to lead an effort of change on the mental health services front. But they are very interested in learning more and want to help in this effort.